Hello, my elegant warriors. I am really excited about this particular podcast. And this time it is also a video cast on YouTube because the topic is so very important. Today, I'm going to talk to you about how to be a powerful patient. So many of you have asked me about this topic since I posted about it on Instagram. And I keep putting it off and putting it off because it's such an important topic. I wanted to make sure that I gave it its full attention and all of the information that I wanted to be sure to share. And I know that it won't be everything to keep it within the time that we need, but I wanted to be really focused as I shared this information with you. And the reason that it came up at this time is last Friday, I gave grand rounds for a number of orthopedic doctors. Grand rounds is something that I have given for many, many years. My background as a medical malpractice defense attorney led me to the opportunity to present to a lot of doctors. And oftentimes those presentations were in something that they called grand rounds. And to be honest, I didn't really think about where that term came from or what it meant. I knew that doctors in the morning would do rounds on their patients. And I knew that that meant that they would go around from patient to patient to patient and see what was going on with that patient, inform the other members of the team what was going on with that patient. And so I just figured, well, grand rounds is a fancy, fancy version of that. But as I was in the Uber on the way to give grand rounds, I was thinking, I really want to know where this came from. So I looked it up in the car. And it turns out that a doctor named William Osler, who was educated in Pennsylvania, which is where I practiced when I was defending doctors in medical malpractice cases, but then went to Johns Hopkins, he believed that patients are the source of medical knowledge. And that's so important for us to pause at and recognize. Patients were the source of medical knowledge, not doctors, not textbooks, not dissection classes, patients. And because Dr. Osler believed that, he started the process of going around patient to patient. And at Johns Hopkins, the hospital was set up in an octagon, so it was sort of like going around. And so that was rounds. They were called grand rounds when Dr. Osler actually showed up at rounds. But now that tradition has continued for many, many years, and hospitals all across the country, maybe the world, but I know across the United States, do grand rounds. And it's now no longer, at least for me, it's not done in the hospital. This was done in an office, and people give grand rounds on all kinds of things. I've given them to doctors on how to increase their documentation, how to make their documentation as good as possible, how to handle the chain of command. And this week, last Friday, it was on how to advocate for yourself, your treatment plans, your patients, your ideas, your team in order to optimize the patient's results. And I was thinking as I was driving about the things that I was sharing with the physicians and how they also apply to patients. And so today I want to talk to you about how to use some of the things that I teach doctors so that you as a patient can step into your power. Because if Dr. Osler is right, and I know he is, that patients are the source of medical knowledge, then that means that you have the power in the healthcare team. You are an integral member of the healthcare team. There is no one on that team who is more important than you are. Think about it. If the doctor does everything perfectly and the nurse does everything perfectly and the tech does everything perfectly, but you don't take your medicine, or you don't do your physical therapy, or you don't wash your wound the way that you're supposed to, you will not get better and you could get worse. So the first thing, and we'll get back to this when I'm talking about the 3 C's of an advocate and how they apply here. But the first thing is to just rest secure in the knowledge that you have the power. I think that many times when we go to the doctor, we sometimes see the doctor as this all-powerful being that we're afraid to ask questions of, and we're afraid to talk to, and we're afraid to express things to. And so we want to counter that a little bit and recognize that you have the power as well. Now, when I go to talk to doctors like I did last Friday, I share the 3 C's of an advocate, and they are curiosity, compassion, and credibility. And I want to share those 3 C's with you as well, but as they apply to a patient. So the first C is curiosity. You, as a patient, want to be curious. You want to be constantly receptive to what is going on here. And you want to be always asking questions. Now, that doesn't mean that you want to always be asking questions of the doctors or the nurses. There's a time and place for that. But you also want to always be asking questions of yourself. We as patients have so much knowledge that we don't always remember or know to give to our doctors. So when I talk to doctors, I talk to them about how they have the curse of knowledge, that they use words and terms that we as patients don't understand. And when they do, they confuse us and we stop paying attention. And that is not good. So I teach doctors to talk in ways that patients will understand. But you, as patients, have the curse of knowledge as well. And I'll give you a great example that happened to me. So, for those of you watching on YouTube, you might be able to see this. I have like a divot in my pinky finger, and my pinky finger sort of bends in. And it hurts sometimes, not so much now, but it was hurting a lot for a while. And so I was like, oh, maybe it'll get better. And I was taking ibuprofen. And ultimately, I went to, this is kind of embarrassing, but I went to an orthopedic doctor. And I showed the orthopedic doctor the divot in my pinky finger and that it hurt. And they did x-rays and they sort of said, well, it looks like you might have arthritis, et cetera. Later, some time later, I was holding my phone and I recognized that my finger was wrapped around my phone right at the place of the divot. And I realized that I was causing this pain by the way that I was holding my phone. And the pain had gotten worse because I had started putting a heavier charger on my phone that weighed a lot more than the old case that I was using. I was able to relieve the pain by changing the way I held my phone. I had the curse of knowledge about the way that I held the phone. If I had gone into the doctor and been like, oh, my finger's really hurting and this is how I hold my phone, the doctor would have been like, okay, you kook, it's because you hold your phone that way. But I had the curse of knowledge. I knew the way that I held my phone so intimately that I forgot what it was like not to know it. You, as patients, have the curse of knowledge. And so you first want to start with curiosity with yourself. What am I missing? That's one of my favorite questions as an advocate. And I was missing that that's the way I held my phone. That's one question that you can ask yourself as you are approaching the healthcare team and your part in that healthcare team. You also want to ask yourself the question, what can't they do without me? What can't these doctors, nurses, what can't this healthcare team do without me? And it might be they can't take your medications. They can't do your physical therapy for you. They can't watch your nutrition for you. They can't stop smoking for you. They can't keep a food diary for you. All of those things could contribute to your optimization of your health, to your power as a patient, but not if you're not curious about what those things are and then, of course, willing to do them. So, if you are looking to be the most powerful patient you can be, and if you are looking to advocate for yourself as a patient and turn your doctors and your nurses and your healthcare team into your advocates, you want to begin by getting really curious about what it is that you bring to the table that no one else on the team can bring to the table. And you also want to get curious about what am I missing? Where do I have the curse of knowledge so that you can share that with your doctors and nurses. Now, there are also times that you need to use curiosity with your doctors and with your nurses. And we're going to get to that next with the next C. But I am well aware, I talk to doctors and nurses and healthcare providers about this all the time, that doctors don't always seem to have time for your questions. They don't always seem to be receptive to your questions. That is a problem. It's a problem that I work with the doctors on, and that's a problem that you need to be aware of. But one of the ways to overcome, or at least touch upon that problem, is with compassion. Compassion is the second C of an advocate. The way that I define compassion, and you guys know this if you've been listening to the Elegant Warrior podcast for any time, is that you can see things from another's perspective, and then you can put what you see into action. So here, if we can see things through our healthcare provider's perspective, we can see that they are really overscheduled because of the way insurance works, because of the way hospitals and doctors' offices works. Yes, they are overscheduled. They have too many patients scheduled in a day, but that's not your individual doctor's fault. That has a lot to do with the administration. It has a lot to do with the way your insurance is set up. And that's a bigger problem. But if we can see things from the doctor's perspective, they are feeling stressed. They are feeling inefficient. They are feeling pressured. They are feeling burnt out. They are feeling impatient. If you can see that, then you can start to speak to that perspective. It doesn't mean you don't ask your questions, but it means how can you ask your questions? How can you communicate in a way that speaks to their perspective? Um, a good way to do that, for example, is to write out your list of questions before you get to the doctors. Now you can hand the doctor the list and the doctor can look at the list as you go through it. You can be super organized as you get there and you go through your list. I love the idea of emailing the list to the doctor before you even go in for the visit. Ask your doctor's office if that is something that's available to you. That way, the doctor knows, number one, if you have a lot of questions, maybe a lot more time to your visit. And number two, they can look at your questions if they have time. I keep saying this because when we see the world from a doctor's perspective, we see that time is at a premium. Doctors are known per research studies to interrupt a patient after they've only been talking from anywhere between 11 and 13 seconds. That's a problem. And it's a problem I work with the doctors on. But if we as patients know doctors are going to do that, then we can work to advocate for ourselves by making that less likely. And so sending them a list of questions ahead of time is enormously helpful. And then just being patient with your doctor when you are waiting in the office and your doctor's running an hour late, which happens often. Change your perspective to recognize that that means that that doctor is spending some time with another patient who has their list of questions. And then when the doctor comes into the room, as hard as it is, don't begin the conversation with criticism or impatience or frustration, because the doctor will feel that energy and it will get in the way of the ability for you to act as a strong healthcare team. You have the power when the doctor walks in the room to increase and improve the energy in the room or decrease and make that energy worse. Use that power. You are the source of power and knowledge. So use that power to try to make the energy in the room as helpful to your healing as it can possibly be. The other thing that I think is worth noting, if we're talking about the healthcare team and you as a powerful member of that team, it's worthwhile to talk about what makes teams work well. And I just did a podcast for one of my private clients on just this topic. And one of the things that's really clear that makes teams work really well is praise. When employees on teams are praised, the productivity of that team goes up between 10 and 20%. Their revenues go up between 10 and 20%. And so you, as a member of the healthcare team, if you praise each other, and I encourage doctors to praise patients, and I'm going to encourage you as the powerful patient to praise your doctors, praise your nurses, especially right now. Guys, they are suffering from burnout at unprecedented levels after COVID and people getting angry and anxious and aggressive and sometimes violent. We are running into a potential shortage of nurses, and our doctors are feeling enormously burnt out. So praise them. Praise them for the way that they show you compassion and curiosity. Praise them when they don't interrupt you. Praise them when they tell you something that you didn't know. That kind of praise can increase and improve the outcomes of the entire team. It's enormously valuable, and it will make you a better source of knowledge for your doctors, and it will make you a more powerful patient. So be curious, be compassionate. And now the third C of an advocate, and you as a patient are always an advocate, that third C is credibility. You want to have credibility with yourself and with the rest of the members of the healthcare team. And now when I teach my clients about credibility, I talk about a belief triangle, and we can get into this. We have gotten into this in other episodes of the Elegant Warrior podcast. But that triangle is they have to believe you, they have to believe in you, and they have to believe that you can help them. So your doctor has to believe you that when you make a promise, you'll keep it. And when you set an expectation, you'll meet it. And so when you promise to stop smoking, or at least reduce your smoking, or reduce your drinking in anticipation of surgery, or to take your medications, or to ask questions when you have them, you keep that promise and you build credibility with the healthcare team. And then they need to believe in you that you have the capacity to do the things. And it's very important that you say, I can't quit smoking. That's not going to happen for me. Own it if you can't do the thing, because that will increase your credibility as well and allow your healthcare providers to allow for it. So don't be afraid to own it if you can't do what the doctors are telling you that they expect you to do. You've got to be honest with your healthcare providers. And then the last piece of this is to Help them to believe that you can help them, that you're not going to make the situation worse, that you're going to give them that praise, that you're not going to be impatient and nasty and violent, because this will improve the entire healthcare relationship. There are so many studies that show that trust is the important factor for the outcomes for teams. And the numbers are just ridiculous. It decreases trust decreases burnout, it increases productivity, it increases happiness on teams. I mean, the stats are out of this world. Now, in healthcare, there's not always time to establish trust. If you're going to a family doctor, an internist, maybe if you have an oncologist, then you have the time and the longstanding relationship to build trust. But if you're going to sometimes an orthopedic surgeon or an emergency room doctor or a trauma doctor, trust takes time, but you can have credibility. You can start right away by making promises and keeping them and letting the doctor know from your energy and your evidence that you are there to help them just like they are there to help you. And finally, with that credibility piece, I want to circle back to the idea that you have to believe in yourself as a vital and powerful part of the healthcare team. What you contribute to the team, no one else can contribute. You know, if your attending were to quit the team or something were to happen to your attending doctor, another attending could step in, but no one can step in for you. No one can lead you as well as you can. No one on the team is as strong and as an advocate for you as you must be. And no one is as powerful as you are. Patients are the source of medical knowledge. You are vitally important to your healthcare team. Use that knowledge. Give your healthcare providers that knowledge, and every single one of us will get better. I hope this was helpful. I would love to hear your feedback on this and all of the podcast episodes. You can email me, heather@elegantwarrior.com. And in the meantime, take good care.